would impact senior services in America and what types of businesses are needed to be developed to meet their needs. I was not familiar with what government, nonprofit, and private agencies offered older Americans. So I began to volunteer my time. I spent 5 months with Senator Merkley's office. I became a certified ombudsman. I was appointed to the Board of Licensed Social Workers. I started an advisory committee for senior services. I spent the last 6 months working with the City of Lake Oswego's planning department on their 20-year comprehensive plan. And most recently, I became a Social Security disability advocate. I immersed myself in 5 areas of aging: housing, healthcare management, wellness activities, technology, and finances. I'm going to share with you tonight information about these 5 areas, tell you what the City of Lake Oswego is doing currently to meet the needs of seniors. I will answer a management question: what do Lake Oswego residents want and need as they age? And I will describe the research process and data collected from surveying residents. I will also reveal a secret that I learned during this study, the secret to aging. Housing is the first area I explored. In Oregon, there are 500,000 people over the age of 65. 92% of those people live independently, alone, with family members, with a spouse, or in a community type setting like a condo or apartment. Some even live in retirement settings like King City. That leaves 8% of seniors living in long-term care. There's 42,000 licensed spots for people in long-term care. They can live in assisted living facilities, residential care facilities, nursing homes, skilled nursing facilities, or adult foster homes. AARP did a study recently showing that 80% of people over the age of 45 want to continue living in their own home even if they need assistance after they age, as they age. This indicates that independent living is the #1 choice for Americans. Healthcare management is the most necessary and most expensive area of aging. Nearly 1 in 2 Americans, that's 133 million people, have chronic medical conditions. 90% of seniors have at least one chronic disease that they must manage. And how do they manage it? By themselves or with a physician. Some have private insurance with healthcare systems like Kaiser, which is all-inclusive care. Others depend on Medicaid and are assigned to a caseworker. There are county and community services, adult day centers, caregivers and companions, and many, many people depend on their family members as they age. There's also the specialized housing, and nearly 65% of people spend some length of time in long-term care during their lives. Wellness activities include physical fitness, brain fitness, civic and social engagement. The American Institute on Aging says an average couple will spend $215,000 on health care after retirement. But these costs can be reduced by staying physically and mentally fit. Physical fitness, mental stimulation, civic and social engagement can protect you from illness and disease. Avoiding isolation and loneliness reduces your risk of medical conditions such as depression, heart disease, dementia, and Alzheimer's. You can probably imagine a person who sits home alone watching television eating a bag of chips is not the most healthy person. The lack of exercise coupled with a poor diet can actually increase their risk of dementia by 52%. And it can increase the risk of heart disease by as much as 97%. Staying active and learning new things keeps your mind and your body healthy and can reduce your medical expenses as you age. Technology continues to change our society, and it will have a huge impact on the aging process as new developments are made. Intel is working on a project called the Global Aging Experience. You may already be familiar with certain types of advancements, such as easy access to your benefits online. Maybe your doctor electronically submits prescriptions, and by the time you get to the pharmacy, it's ready for you. There's no more waiting 20 minutes for a prescription scribbled on a piece of paper that your doctor wrote in his bad handwriting. I even have one doctor who does medication checkups using Skype, so no need to even go into a doctor's office anymore. Emerging technologies are being designed to reduce medical emergencies in people's homes and give people easier access to medical care. For example, sensors in floors, monitors on stoves, motion sensors on doorways can detect illnesses and reduce the chances for falls. And falls happen to be the number 2 killer of people over the age 75. Now, the area of financing is the most complicated. Talk of finance and wealth management literally scares people, either because they haven't done planning or they fear they're not going to have enough savings. 61% of people who were surveyed in the U.S. feared outliving their money more than they feared death. At least 10% of boomers will depend 100% on Social Security after retirement. But is Social Security enough? Only if you want to live below poverty level. Living into your 80s and 90s can be very expensive. Long-term care costs on average $3,000 to $6,000 a month, and memory care can be double that. Long-term care insurance will pay for it. Or if you do spend down all your savings, Medicaid will cover the cost. Learning about these 5 areas led me to explore what was happening here in my community of Lake Oswego. After interviewing several key community leaders and working with the planning department on the 20-year comprehensive plan, I learned that not enough resources are dedicated to developing senior services and planning for the aging population. After doing this discovery work, I wrote a survey that would answer the following questions. What do boomers want and need as they age? How are today's seniors meeting their needs in Lake Oswego? Is technology a viable option for safely aging in place? But the real management question actually came out of the city council meeting during a work study on aging in place. One city councilor wanted to know what the residents want. Assumptions were made that many residents would move out of Lake Oswego after retirement for a variety of reasons, including that it's just too expensive to live here. However, with the recession, loss of investments, and a decline in the real estate market, it may be difficult for a person to move even if they want to. So if you're not familiar with Lake Oswego, it's only about 5 miles wide. It stretches from I-5 to the Willamette River, and it's only 20 minutes south of downtown Portland. It takes approximately 15 minutes to get from the west side of Lake Oswego to the east side of Lake Oswego. And Lake Oswego occupies 2 zip codes, each with their own business district. But most of the activities and services offered by the city of Lake Oswego are located in downtown Lake Oswego. People who live in the Lake Grove district do not feel connected to the east side. It's easier for west side residents to travel to neighboring cities for services than go to downtown Lake Oswego.